Hello everyone, we are Group 9 and the topic of our today's video will be methamphetamine. So in today's video, some of the topics that we will be covering will be introduction, the pharmacokinetic and pharmacodynamic effects of methamphetamine, the molecular pathway, side effects, and the medical dosage. So I'm Ramti and I will be going through a quick introduction. So methamphetamine is a highly addictive stimulant of the central nervous system that floods the brain with dopamine. Its chemical formula is C10H15N, and the molecular weight is 150 grams per mole. As you can see, the chemical structure here as well. There are multiple different methods of using it, mainly snorting it, swallowing it, smoking it using a glass pipe, and injecting it directly into your veins. And it's usually available in crystal clear chunks and shiny blue rocks.
What are the pharmacokinetic effects of methamphetamine? Approximately 70% of methamphetamine dose is excreted in the urine within 24 hours. 30 to 50% as methamphetamine, up to 15% as 4-hydroxy-methamphetamine, and 10% as amphetamine. Urinary excretion of methamphetamine may be enhanced by acidifying the urine with oral ammonium chloride. Methamphetamine has been detected in urine 7 days after completing a regimen of 4 daily 10 mg doses, and in one case following a single 250 mg oral dose. Through vapor inhalation, also known as smoking, methamphetamine bioavailability ranges from 67% to 90%, which depends mainly upon the smoking technique. Smoking results in the rapid appearance of methamphetamine in the plasma, indicating efficient transfer of drug from the alveoli into the blood.
The molecular pathway of methamphetamine. Methamphetamine is taken into the bloodstream by snorting, injecting, or even smoking. When methamphetamine enters the bloodstream, the heart pumps the blood throughout the body and up to the brain carrying the methamphetamine. When methamphetamine have entered the brain, it elevates the level of extracellular monoamine neurotransmitters, mainly the dopamine. As you can see in this third picture here, the dopamine are produced more than normal level. In the synapse, on the presynaptic cell, the dopamine are unable to go back into the transporters due to the presence of meth and blocking the transporters. Many dopamine remains in the synapse in the brain, gets trapped for a longer period due to the transporters being blocked by the presence of meth. This causes the user to feel euphoria and get addicted to the meth.
I'm going to talk about the pharmacodynamic effects of methamphetamine. The direct effects are reduced fatigue, euphoria, positive mood, accelerated heart rate, elevated blood pressure, pupil dilation, increased temperature, reduced appetite, behavioral disinhibition, and short-term improvement in cognitive domains. Reports of negative responses, particularly anxiety, are also common. Cardiovascular and subjective effects appear to increase dose dependently. The adverse effects are shivering, dyspnea, agitation, dilated pupils, tachycardia, hypertension, and rapid respirations. The other adverse effects are psychosis, cardiovascular complications, methamphetamine withdrawal syndrome, neurotoxicity, neuropsychological impairment, Parkinson's disease, and teratogenic effects.
Now, let's talk about the short-term side effect of meth. It can cause hyperthermia, euphoria, cardiovascular problems including rapid heart rate, irregular heartbeat, and increased blood pressure, brain damage, and mental change. Now move on to the long-term side effect of the meth. It can cause addiction, which is a chronic relapsing disease, a negative behavior such as significant anxiety, confusion, insomnia, mood disturbance, and violent behavior. Psychotic feature including paranoia, visual and auditory hallucination, and delusions. A change in brain structure and functions where it can affect emotional, cognitive, decision-making, and impairs the ability to suppress habitual behaviors. And lastly, severe dental problem, such as tooth decay and tooth loss that can cause by poor nutrition, dental hygiene, dry mouth, and teeth grinding.
Now we will be talking about the medical dosage of methamphetamine. The normal medical dosage ranges from 2.5 milligrams to 10 milligrams per day, or in extreme cases, 60 milligrams. Dosage for obesity is 5 milligrams per day, 30 minutes before each meal, while dosage for ADHD patients is 20 to 25 milligrams per day. Now, methamphetamine is a psychostimulant drug, which means that diversion from these medically prescribed doses can induce addiction and overdosage. Overdosage of this drug can lead to acute and chronic cardiomyopathy, chronic hypertension, and depletion of catecholamines. Moreover, dyspnea, edema, and signs of CFH are also registered with methamphetamine toxicity. That is the end of our presentation. This is our reference list. Thank you so much for listening. Have a great day.